name is Taryn Harris. I'm an FNP student at the University of Memphis. Today I'm going to be doing a head-to-toe assessment. To start off, I've already identified my patient's name and date of birth. And I'm dyslexic, so some of the words might not sound as accurate as they should. To start off, I'm going to, throughout the assessment, I'm going to look at her skin. With her skin, I'm going to be looking at the color of her skin. And I'm going to be looking at the color of her skin, the texture of her skin, looking for masses, any edema, and masses, edema, the temperature of her skin, the skin turgor, any bruises, any lesions, and any nevi. Then I'm going to inspect her head. With her head, I'm just looking to see if it's symmetrical and midline. Then I'm gonna go to her scalp, and with the scalp, I'm just checking for masses, tenderness, the color, the texture, any infestation. Next, I'm gonna palpate her lymph nodes. With her lymph nodes, I'm gonna palpate her pre-auricular, post-auricular, occipital, tonsillar, cervical, post-cervical, submandibular, submental, supraclavicular. Next, I'm gonna check for cranial nerve number 5. The motor, if you could clench down and move your jaw from side to side. No crepitus, no tip. Next, I'm going to check her, if you could just close your nose. Not close your nose, close your eyes. And tell me what you smell. Peppermint. Yes, peppermint. Then I'm going to check for cranial nerve number 7. With cranial nerve number 7, if you could just smile, frown, smile, okay. Puck out your lips, puff your cheeks out, and raise your eyebrows. Okay. Next, I'm going to go to her ear. With her ear, I'm going to be inspecting her outer ear for the shape and position. I'm going to be looking for, I'm going to check her auditory canal and tympanic membrane. I'm going to palpate her pinea and targus for masses and tenderness. Looking at the tympanic membrane. It is pearly gray. All right. Next, I'm going to check cranial nerve number 8, the whisper test and Weber test and Reiner test. If you could close one of your ears. Tell me what you hear. 1, 2, 3. 1, 2, 3. Okay. ABC. ABC. Okay. Now I'm going to do the Weber test for lateralization. Tell me if you can hear. Then I'm going to do a Reiner test. Can you hear? Yes. All right. Next, I'm going to be doing the checking her eyes. With her eyes, I'm going to be looking at inspecting her lashes and brows and papillary fissures and sclera conjunctivi, and I'm just looking for color and discharge and any lesions. You can cover one eye. I'm going to ask you to read this chart. Which one can you see? The lowest line that you can see?
EFTZO.
Okay, cover the other eye.
EFTZ.
Okay, both are 20/30 vision. Then I'm gonna do the peripheral test. If you could just tell me when you can see my finger.
Now.
No. Okay, next I'm gonna do testing for accommodation and conversion. If you could look at the wall, then look at my finger. All right, then I'm gonna check EOM, and that's cranial nerve number 8, 4, and 6. Okay, next I'm gonna look at her pupils. Just checking for to see if her pupils are round or reactive. And they are. Next, I'm going to check to see her red reflux. Okay, no abnormalities noted in red reflux. Next, I'm going to do her nose. I already did the smell. Yeah, I did the smell. But for the nose, I'm going to check to see if it's midline and straight. And now if you can include one of your nostrils. Okay, if you could blow out and sniff. Okay. All right, I checked for patency of her nostrils. Next, I'm going to check for her throat and mouth area. And I'm just going to be checking for her lips, her gums, buccal mucosa, her palate, tongue, and salivary ducts, posterior pharynx, and tonsils. All right. All right, lift your tongue up, down. All right, her tongue is midline and symmetrical. No tonsils noted. Next, I'm going to check her thyroid and palpate for her carotid. You could turn. All right. I'm going to listen to the carotid. I'm listening to see if I can hear any burets. Okay, you hold your breath. I'm listening with my bell. All right, next I'm going to check the range of motion in the neck. If you could look up, down, side to side. All right, round around. All right, and if you could shrug your shoulders. Okay, checking for resistance. Next, I'm going to check her posterior chest. If you could just turn. Can you turn some more? Sorry. I'm checking for chest expansion. Breathe in and out. Okay, I'm going to do tactile premises. Just say 99.
99, 99, 99, 99.
Okay, I'm going to percuss in the intercostal spaces. All right, now I'm going to listen. You just take a deep breath in. All right. Next, I'm going to check FOD. If you could say E every time I touch your chest.
E, 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 E.
Okay, now say 99.
99, 99, 99, 99, 99, 99.
Now can you whisper 1, 2, 3? Okay, that check test bronchoscopy and the whisper as well. Now I'm gonna do the interior. If you could say 99.
99, 99, 99.
All right, I'm gonna listen as well. All right. Next, I'm going to check the heart and checking and listening to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Erb's point. I also checked for a full minute the rate and the heart rate for a full minute of the apical pulse. Next, I'm going to have her lay down. I'm going to look for the contour and symmetrical of the okay, I'm going to palpate and listen again. And I'm doing it with my bell. And I'm going to check her JVD. It's not noted. Then I'm going to check her abdominal. I'm going to check iliac, femoral. Listen, again, we're going to listen to her vowel sounds. In all four quadrants. I'm palpating for the liver and spleen. All right, if you could, I'm going to have her sit back down and I'm checking for tenderness. Turn around. Any tenderness?
No.
All right, no tenderness noted. Then I'm going to check her musculoskeletal, and I'm going to be looking at her joints and stuff. And I'm going to start with the fingers. Just palpating. Finger grip, squeeze my finger. Okay, palpating the joints of the fingers and the wrist. Range of motion, flex down, extend, hyperextend, adduct, adduct. Alright, then we'll do the wrist. Rotating the wrist, the elbows, range of motion, flex, and shoulders, look, down, rotate. Alright, if you could just put your arm behind you. Alright, the other one. Alright, I'm checking resistance, biceps and triceps. If you could just pull down. Alright. I'm going to test sensations. If you could tell me if it's sharp or dull. Close your eyes.
Dull. Dull. Sharp. Sharp.
All right. Tell me if you feel the sensation in your wrist. Then maybe of the layers. Oh man, keep stopping. Okay, if you could just tell me the number that I write in your hand.
8. 8. 0.
Okay. And can you just tell me what object?
Pen.
Alright. Alright. You can open. Okay, next I'm gonna check the DTR. I'm gonna do the biceps. Oops, sorry. Triceps, biceps and triceps. I didn't mean to get it hard. Alright. Achilles. Can't see. Short. Okay, Achilles. Babinski. Alright. I'm going to be checking the cap refills. Then check the range of motion. If you could just, range of motion and strength. If you could pull up, down, look. Okay, your toes, push down. Okay, you stand up. If you could side to side. Okay, just palpating the hips. If you bend. All right, I'm also looking at her spinal area to look in any scoliosis or any curvatures not noted. Okay, go back. All right, side to side. No, side to side. Do a circle. You do a circle.
Oh, wait.
Okay. Then I'm going to do check her gait. If you could go back. Walk. All right, and come back. All right, I'm gonna check your hips. If you could keep your leg out to the side, go back in, the other leg, back. Can you hyper, right? Okay. If you could close your eyes and put your heels together, sit still. Negative 1 bird. All right. What else? I would ask her to hop on each foot, but I don't think that's safe for her. But that concludes our head to toe assessment. Thank you.